Good evening, everybody, and welcome you all to our very huge program. And requesting Surendra sir to take the class forward. Surendra sir, please go.
Good afternoon, good evening, everyone.
Good evening, sir.
We have been dealing with dosha in command. How it is systematically fragmented and compared with Soviet. I told you what is the fundamental property is dosha. More air, more water, more fire, or less air, less water, less fire. They give imbalance in the body. If there are two solid, the body will manage. If it persistently continues, then imbalance takes place. Thereby, this is the condition happens. In such is the case, some symptoms are exhibited by frequent headache, frequent pain in the legs, frequent loose motions or dysentery in the area, frequent indigestion, urine, breathing problem. All these things are called the imbalance. Due to imbalance, they exhibit as a disease. They have said that categorized three doshas and what are all the combinations of the three doshas, and they have also analyzed what all the causative combinations and they are given diseases and how it is handled. The techniques, less air, more air, or more air and water, air and fire, like that. So, they indicated this as simple B. B indicates air,
Yes, ma'am.
P indicates
Yeah.
fire, K indicates water. When air and fire is there, it is indicated as liquid. When air and water is there, it is indicated as decay. When water is there, it is indicated as peak. If all the three elements of nature are not there in the body, that is BPK, air, fire, water, it has been indicated as extreme condition, chronic condition. So what happened? Shall we say, like a body. Like a body that there is brightness and air and fire. Yesterday's Hippocrates, they indicate as air and fire. Like that they go to them all. It is only for us to go through this. Go through organization. You said everything. The patient comes in. How do I know whether there is got excessive air in the body that causes a disturbance, etc. But the right hand, pulse reading is different. What the pulse reading says, many dangerous situations where the conditions certainly have been found out by reading the books. How do they read the book? I don't want to go deep into it. I will give you only proof. If the pulse is hot means it is more wear and tear. If the pulse is jumping, it is more fire. If it is slow, pulse is slow, it is with more water, body movement. Then comes analysis. You must understand the different modes of pulse. Pulse flowing excess resembles like a snake or breeze. Snake moves forward quickly in a zigzag. So pulse also is a zigzag movement. And the excess element of air, for the sake of convenience, is called spark pulse. When the element of fire is erased, pulse resembles the movement of a crow or a frog or a parrot. Frog jumps forward, jerky manner. Pulse motion gives jerks when building it. It is excited and agitated, that is pulse. Get excited and agitated and indicate the excessive element of fire. The element of water predominates. It is called simple for a pigeon, a peacock, a swan or a cock. That is, they behave like these animals, birds. Pigeon, very small, low moon, soft moon. Peacock, similar. Swan, calmly move, whatever we may discover. Then cock, step by step, the swan, restricted moon, clear indication of water. For the sake of convenience, this kind of pulse is called slow pulse. Now, the exchange in air is indicated what is the type of pulse. The exchange of water, what is the type of pulse. The exchange of fire, what is the type of pulse is indicated. Now, we know the methodology of elements of air, how it behaves in the body, how it gets deranged, how it produces symptoms, how the symptoms become disease conditions. When we come to the patient, how the physician can understand. He knows the medicines with the three divisions, air, water, and fire. He knows the disturbance. He knows the disease. What are the diseases that can take? Less air, more air. What are the diseases that can take? Less water, more water, like that. So you know what is the disease? It is somewhere, for example, arthritis. What it comes? Friction, movement, difficult, pain. How it causes? Because more fire, less water of smoothing agent. That's primary reason. Other things are there. More you study, you can understand more. Then, so you are not correlating the disease with your nomenclature of the disease. Then you know what are the medicines that contains to overcome the disease. Then you also get it controlled by reading the pulse. Also get controlled with more water, more less water, fire, and air. Readings are there, different readings are already there. With all these combinations, you arrive at the deficiency or deficiency. Then you select it. Yes. Then I'll go to one more. We know what are the food contains. Apple contains more air. Banana, it contains more air, more water. Like that, we know the food contents, what are all its combinations, whether it is more watery, more air, more fire, etc. Then we also know how the patient feels, how the mentality of the patient is there. All that countries, we select this. What are the methods to select the medicine? What are the methods to select the medicine? By going through the history, by going through the conditions today. Supposing it's a winter month, it's a summer month, it's a ordinary time, it's a spring time, etc. All these proofs we see what are the conditions. Now you imagine how the yogis, munis have been assessing the disease condition. They know the herbs. They know the condition of the patient. They treat with those herbs. They go and pick up the outskirts of the village, give the preparation, simply copy, think that it is correct. Possession of all the knowledge. Unless you possess all the knowledge. So same thing applies also even in homeopathy. It has been indicated in the form of philosophy. You know the philosophy. You know the power of the religion. You know the way in which the preparations have been made and patentized. You know what are the medicines that have been administered in the nature form. You know the combinations, what should follow what, like that. You analyze it with the patient. You take the totality of systems. What is the totality of systems? Knowing the body condition, how he expresses his disease condition, how the physician understands the disease condition, how the medicine has to reflect that mortality of symptoms, life statistics, morality. That he gets problem in the evening, he gets problem in the early morning, otherwise this is morality. Like this, homeopathy has differentiated. Sir, what is the difference between these two? Are we not going to die with confusion? Not at all. Not at all. Because both the philosophies are built on the same thing, except where nowadays we are not reading the pulse, so we are not able to understand the nature of the deficiency, the fire, lacking water, lacking air. But those things are accepted by the symptoms. So we know the medicine. We know the medicine which contains characters. That is fire and water, only water, only fire, or combination. With this, we try to diagnose that are we not going to fail to make confusion in the dosa in homeopathy and pure homeopathy. Right? We are not asking you go to the Trikosa and the material medical and take the case taking procedures 7 days. You are not at all going to ask the question to the patient. Do you feel more thirsty? Do you feel more friction in the legs? Etc. No. He tells me, sir, I feel thirsty about that. Sir, I feel headache only in the evening. We go only first the process of homeopathy alone. The more and more you understand the homeopathy, you are able to master the condition. You are able to give medicine. The patient comes, sir, I am having headache. What is the season now? It's a winter season. The winter season means headache is Gelsin or Silesia. The patient is in smaller blood. So, excess accumulation of water comes out. Give arnica along with Gelsin and Silesia. It is winter condition. In the summer condition, it is belladonna, heat and redness. Migraine, headache is different. You are studying the case. So, you are able to acquire knowledge in a different sense. Though it is synonymous and equal in the application. In fact, if you read the pulse as well as study the patient, then you can understand the patient very easily than ordinary middle-class doctor who is just observing and taking the case with the symptomatology like this other phenomena. Now, you are here giving one more additional information according to body condition, we also indicate what are the foods you have to take and not to take. Because we know what are the foods contain more water, less water, more fire, etc. So we advise them according to the medicine. We advise you what are the foods here. So it has been separate branch of nutrition and nutrition in the hospital. So Siddhartha helps you provided you master that. But don't apply that first. Go to your homeopathic philosophy. Follow that. But referring to what sir, can understand the patient more air, more fire. So this is the divine difference that has taken place. So like that we can overcome this and including the Siddhartha I'll take next one. I think you will not understand any doubt in this, you can handing over other people.
Rheumatoid arthritis. Today we will be revising this topic. Rheumatoid arthritis, something which we all always remember and know. What is happening in our system and why do some people have difficulty walking when they are going old? What exactly is happening? Whether it is avoidable or is it a autoimmune disease or whatever, we will just go through this and see what it is. So rheumatoid arthritis is an autoimmune disorder. So it is not from any infection from outside. It's an autoimmune disorder in which immune system identifies the synovial membrane, the membrane that is lining our joints. It's called synovial membrane. It will be thinking that the immune system will think that these membranes are not the part of our body and they will start attacking it. So when the body attacks the synovial membrane, that becomes damaged and then we will have difficulty in moving our joints. So this is the essence of the problem, rheumatoid arthritis. So the definition is rheumatoid arthritis is a chronic inflammatory disorder that may affect many tissues and organs, but mainly attacks the joints producing an inflammatory synovitis. So basically, rheumatoid arthritis is an autoimmune disease which will cause inflammatory synovitis, synovial inflammation. So that is what we call rheumatoid arthritis. So we can see a normal joint which is very smooth and everything is full. There is a synovial fluid between the joints so that there will be lubrication, and we can see it's a very smooth type of joint. So when it is affected, we will see how it is. When it is affected, you can see the smoothness, everything is gone. Everything starts getting eroded. The bones are getting eroded. The round shape, the bone what we had, is getting eroded. The synovial areas, everything is getting eroded, and this is how the rheumatoid arthritis joint will look like. Even though the synovial fluid is there, it is very limited, and the inflamed area will be fully covering the joint, and that is why the joint becomes stiff and not possible to move. So, risk factors. Idiopathic factors, positive family history. Family is it's like a hereditary thing. If your forefathers or the parents are rheumatoid arthritis, chances of you getting it is very high. Inherited tissue type major histocompatibility complex and antigen. There is an antigen which is inherited, and that is the cause of this problem. Then smoking will enhance the problem, bacterial and fungal infection can also trigger this factor. Herpes simplex virus can also cause this problem. Then Epstein-Barr virus, is EBV, also can be a cause. Vitamin D deficiency also can be a cause of this rheumatoid arthritis. So incidence will be, like you can see how much in the USA they have done a study, and they found that 0.5 to 1% of USA population has rheumatoid arthritis, and the females are having more problems than male, and that is 3 females will have 3:1 is the ratio. Females will be 3 and males will be 1. So almost 0.5 to 1% of American population is affected by this thing. Same thing will be here also. It can be little more than that. But people of any age can be affected. Peak age will be 45 to 60, but onset early from age 20 to 45 years. So the most average seen is 45 to 60 years old. That's why we said it is important for our age group people. So now the onset can be from age 20 to 45. About 75% of these will be women. The affected people, 75% will be women, and the disease strikes women 3 times more often than men. So that is the problem. So now all the ladies have to be very careful about this and try to see what best can be done to avoid or better this problem. So ladies are getting this more than men, 3 times more than men. So the pathophysiology is the presentation of antigen to T cells. Presentation of antigen to T cells. Then T cells and B cells proliferation, angiogenesis in the synovial line. That means these are all technical things, but T cells and B cells are immune things, and they migrate and multiply into these synovial area. Neutrophil accumulation in the synovial fluid. That is RBCs. One of the WBCs accumulate into this the synovial. This because of the immune system, immune reactions. The neutrophils are more WBCs are seen inside the synovial fluid, and that in that specifically neutrophils are seen. Synovitis is the inflammation of synovial area, synovial joint. Then there is early Pannus formation. This Pannus formation means the Pannus is a sheet of inflammatory granulation tissue. That because it is inflammation, a sheet of tissue is formed inside the joint, and that is called Pannus. And the sheet of granulation tissue that spreads into the synovial building and invades the joint. So this is basically there is an invasion of tissue inside the synovial area, which is supposed to be flexible and freely filled with the lubricant oil like synovial fluid. Instead of that, the tissue starts developing, and that's called Pannus. It's a sheet of cells which will grow and occupy the area so that the joints cannot be functional at all. This is the thing. And then the subchondrial bone erosion. That means the cartilages will be beneath the bones, that is will be eaten off. That's called subchondrial bone erosion. Pannus invasion of the cartilage and chondrocyte proliferation. So Pannus is the tissue which we discussed now, and we were going into the chondrocyte, that is the cartilage tissues, and it will go there and occupy the space where the cartilage is supposed to join. Then laxity of ligaments. The ligaments will not weak, and they will not be able to hold together the bones together, so that will also the shape will be distorted. Joint instability, contractures, decreased area of the movements, and the systemic complications. So all these things, our range of movement will be decreased. The joint will be unstable, and contractures will have difficulty in movements. So that will be the total pathophysiology what we can see with this rheumatoid arthritis. So now we will see the signs and symptoms of arthritis. By the picture itself, you can see how distorted the hand of this person is because of this rheumatoid arthritis. The joints of the hands are often the very first joints affected by the rheumatoid arthritis. Normally, hands are affected first. These joints are swollen, red and tender and squeezed. So you can't even hold their hands; they will feel very badly, pain will be very bad, so that they're not even give you a shake hand, because when touch they will cry. That's why it's called tender, and when squeeze, you can see the joints are the whole, the hand joints, everything are really swollen up and distorted. So this is and the hands are affected. You can see rheumatoid arthritis hand, you can see the fingers and all the bones are like what, even though it is pressed like this, from inside you can see the synovial fluid is wider, and the thickening of synovial membrane, that is why the shape has become bunched, and then the cartilage is degraded, so that when you move it is paining for you. So this is the distortion, and the cross section of the distorted area shows like this. So everything inside is going back to the joints. So another rheumatoid arthritis hand, you can see the picture how bad it is. So now we will see different types of deformity. The rheumatoid arthritis is swan neck deformity. Swan neck, swan is a bird, and its neck type of deformity is called swan neck deformity. The fingers will look like swan's neck. Deformity arises by hypertension, hyperextension of the proximal interphalangeal joint. So hyperextension, that means one is pulled beyond recovery. One area, this interphalangeal joint, while the distal interphalangeal joint is flexed. So the top one is stretched beyond normal, and the inside one is pulled up and it is flexed. So that is how it is called swan neck deformity. So there are different deformities, mammoth-like deformity, and another like the V type of deformities. So there are different types of deformities, and these deformities, muscular changes, and the bone deformities. So swan neck deformity is seen here in this finger, and the finger is like a swan's neck. Mammoth finger is a simple flexion of deformity of the distal interphalangeal joint, preventing extension. So once it is bent like that, you can't extend it further. Basically, if you try to move also, it will come back to this position, because the muscle has interphalangeal joint has been pulled up. Deformation has happened. So now said type deformity. It's called said deformity of the thumb. Severe extension, hyperextension of the interphalangeal joint of the thumb. That is why normal thumb is this, and the interphalangeal joint of the thumb has been severely extended. So it is bending backwards. So now we will see rheumatoid arthritis symptoms. What are the symptoms you will see? Fatigue will be there, joint pains, joint tenderness. So that means if you touch off, anything touches there also it will be painful. Joint will be swelling, joint will be will have redness, warmth will be there in the joint, joint is stiffness in the joint, joint loses the range of motion, ROM, range of motion is lost. Many joints are affected, polyarthritis is called, limping will be seen, joint deformity will be definitely seen, and both sides of the body affected is symmetric. If both sides are affected, it's called symmetric, otherwise it's called asymmetric rheumatoid arthritis. So how do you diagnose this? X-rays of the hand and feet are generally performed by people with rheumatoid arthritis. That is MRI, magnetic resonance imaging, can be done, ultrasounds can be done to see what is exactly happening to the problems, the joint, and we can assess the problems. So X-rays, MRI and ultrasounds can be used for diagnosing the problems. So now with blood tests can be diagnosed. Rheumatoid factor, RF factor, is an important antibody in the blood, which can is specific for rheumatoid patients, rheumatoid arthritis patients. So RF factor, rheumatoid factor. A negative RF factor does not rule out rheumatoid arthritis. If you don't have rheumatoid RF factor in your blood, still you are not ruled out to have rheumatoid arthritis. The arthritis is then called zero negative. So in the serum it is not there. Most common during the first year of illness and converting to zero positive status over the time. So initial stage, the serum may not have RA factor, RF factor, rheumatoid arthritis factor, and rheumatoid arthritis cannot be ruled out because you don't have it. It will be slowly shown in the coming years, but you will have rheumatoid type of symptoms shown. So that is why when you go test also, if you are positive, fine. If you are negative, don't feel that you are not affected by rheumatoid arthritis. You can go for other tests also. Citrulinated protein antibodies. So this is another thing. Anti-citrulinated protein antibodies. Like rheumatoid factor, this testing is positive or only positive in a proportion of all in a proportion of all rheumatoid arthritis cases. So this will be in some portion or some proportion only will be seen. Unlike rheumatoid arthritis, this test is rarely found positive if rheumatoid arthritis is not present. So this is a better test. If it is not there, that means you are not rheumatoid arthritic. You are not a rheumatoid arthritis patient. So anti-citrulinated protein antibodies is the best test, and it will give you 95% specificity. The RF factor alone will check, you may be positive or negative, but still may have. But if you do this anti-citrulinated protein antibodies testing, then and if you are more positive, definitely you are a rheumatoid arthritis patient. Other blood tests performed for rheumatoid arthritis suspected is erythrocyte sedimentation rate, ESR, which everybody takes. The rate at which the blood cells precipitate in an hour is called the ESR. So that is, if it is high, then you have a chance of getting rheumatoid arthritis. And C-reactive protein, we are all familiar with the C-reactive protein during the COVID times. The protein found in the blood is responsible for inflammation. The COVID times, everybody used to say C-reactive protein test is positive, then there is inflammation in the body, and you are having some problem going on in the system. This will be, if you are having rheumatoid arthritis symptom and C-reactive protein is high, then you have a problem. Then full blood count gives the information about all blood cells, that you can check. Then gives renal function, kidney function, and liver enzymes also give you some information about that. Gives information about state of the patient's life. So these are the blood tests also indicators for rheumatoid arthritis. Now, allopathic methods of management is salicylates are given, acetylated salicylates are there, that is aspirin. Acetylated salicylates are aspirin. Non-acetylated salicylates are choline magnesium, trisalicylate, and choline salicylate. So these are all allopathic medicines which we may not be able to use, but we will just know it that these things are available. Now there is non-steroidal anti-inflammatory drugs, that's NSAIDs. There are different names of those things. Commercial names are also there. This diclofenac is Voveran is called. Etodoclac is Rolene. Fluoride-bipropofan, I can't even pronounce it. So it's all these ibuprofen is there. Then these are all NSAIDs which are available, which will be prescribed by the allopaths. Now if we go to our medicines soon, then the medical management is disease modifying arthritic drugs. Anti-malarial drugs will be useful, and action will be anti-inflammatory medicines, inhibits lysosomal enzymes, and hydrochloroquinone will also a malarial drug, and chloroquinone. So all these things are anti-inflammatory, and it will inhibit the lysosomal activity. Lysosome is the destructive organelle in the cell. So every cell has lysosomes, and when it starts breaking down, the cell gets destroyed. So anti-inflammatory drugs will prevent the lysosomal activity. So inflammation will be brought down. Gold-containing compounds. Gold-containing compounds will also inhibit the rheumatoid arthritis. Action will be inhibits T cells and B cell activity, suppressing synovitis during active stage of rheumatoid arthritis. So this is the one of the other medical management adopters follow. Then orothioglucose and then it is gold orothioglucose is there. Then gold sodium thiomelate, oranopin. These are all medicines which contain gold. So these medicines are also useful for stopping the inhibiting the T cells and B cell activity and suppresses the synovitis. Immunosuppressants like actions of immunosuppression affects the DNA synthesis and other cellular effects. This methotrexate, then azathioprine is there, then cyclosporamide. So these are immunosuppressants are there, and then corticosteroids are also there. Actions of that will be anti-inflammatory, analgesic, used for short duration and at the lowest dose possible to minimize the adverse effects of rheumatoid arthritis. So these are which we spoke are all allopathic methods. We will not be able to access it. You will see what homeopathy will do after this. So corticosteroids and topical analgesis are there, like captacin, where we can apply those and you will feel better. So external application also is there. There is surgical management, because certain times, as I told you, tissue developments will be there within the joint, and the joint will become packed with materials which is not normally there. So they have to surgically remove those unwanted tissues and reconstruct the unwanted the broken joints, and then do it. That's called arthroplasty. Is to replace the part or small part of the joint, such as hip or knee. So that will be replaced. Then arthroscopy, which is using small lighting instruments to remove debris or inflamed tissue from a joint. So these are the type of surgeries. Then carpal tunnel release to relieve the pressure on the median nerve on the wrist. So these are surgical corrections are also available for arthritic patients. Then cervical spine fusion. So sometimes because the joint is so bad and it will not move properly, sometimes they will be fusing the bones together. Fingers and hand surgeries to connect the joint problem. Foot surgeries for phalangeal head resection and sinopectomy, which will reverse inflamed joint tissues. So these sort of surgical corrections are available. Nursing diagnosis, acute and chronic pain related to inflammation and increased disease activity, tissue damage, fatigue or lower tolerance levels. So these are all which will be seen and understood by the nurses or people who are managing the patient. Fatigue related to increased disease activity, pain, inadequate sleep, rest, decongesting, inadequate nutrition, emotional and stress and depression. All these things will be seen by them. Disturbed sleep pattern related to pain, depression and medication. Self-care deficits related to contractures, fatigues or loss of motion. So all these things will be seen by the attendants and nurses. Impaired physical mobility, that the patient cannot move by themselves, and decreased range of motion in the muscles will be noticed. Then there will be limited endurance, lack of or improper use of ambulatory devices. So anything there, the machines are common basic spoons and forks and everything, they cannot even use it. Then disturbed body image related to physical and psychological changes and this dependency imposed on chronic illness. So these are the things they are dependent on other persons to support them to even move around. Ineffective coping related to action or perceived lifestyle and role changes. So they will not be able to cope up with the normal lifestyle also because of this deformity. So now, rheumatoid arthritis, we will see which are the natural medicines which are helping. Natural treatments is turmeric helps out there. Arnica, natural arnica, the poison ivy, Bryonia and Apis mellifica. These are the rheumatoid arthritis natural medicines. So we will see how it is effective. Now, rheumatoid arthritis, we will see how homeopathy can help us. Antimonium chloride. Antimonium chloride is a mixture of elements, antimony and sulfur. As a homeopathic remedy, it's typically used to treat digestive issues. However, it is useful in treating arthritis, especially in finger joints. Arthritic pains in fingers, twitching of muscles, jerks in arms, weakness and shaking of hands in writing, followed by offensive flatulence, feet very tender and pain in the heels. So these are the symptoms for which will ask for antimonium chloride, which will be very useful for patients who are suffering from these sort of symptoms. Now next is Apis mellifica, made from bee venom. Apis is used to treat joint swellings when the joints are red, inflamed, burning or stinging. So edematous synovitis. So when the synovitis, the synovial joints are swollen, the talon in the beginning, then knee swollen, shiny and sensitive, so with stinging pain. So stinging pain, so swollen, this thing are symptoms of bee stings. So this will also work. Knees swollen, shiny and sensitive, sore with stinging pain. Feet swollen and stiff. Feel too large. We feel the feet is too large. Rheumatic pain in the back and the limbs. Tired, bruised feeling. Numbness of hands. Tips of the fingers will be numb. And eyes is itching and intolerable itching, and rheumatic swelling. So these symptoms, if you have the patient is having, definitely you can give Apis mellifica. Arnica montana is indicated for rheumatic arthritis, rheumatoid arthritis, when the joints are tender to touch. When the patient is not allowing for legs or joints, then arnica is the best thing. Arnica is an anti-inflammatory agent and is suggested for gout. Patients having greater fear of being touched and approached. When you go near them, they will set aside. For such people, this arnica works. Rheumatic pain in the back and limbs, as if it's bruised or beaten, sprained and dislocated feeling. So you feel the joints are dislocated. Soreness after over the exertion. When you do some work, you will feel too tired and worn off in the joints, and the joints will be paining. Everything on which he lies seems too hard. So when he sits on a chair or a sofa or anything, he feels it is too hard. Deathly coldness will be there, and the arms will be cold. Cannot walk erect on account of bruised pain in the pelvic region. Back pain, he'll be bending or stiff and walking. When applied topically, arnica may reduce the pain and bruising. Arnica ointments are available. Arnica can be mixed with coconut oil or any other oil and can be applied in the area. Arnica cube. This will relieve the problems of these rheumatic pains. Bryonia is used for treating arthritic pain, particularly in the knees and elbows, bigger joints. No? So it is indicated when the joints are red, hot, swollen and painful. More specifically, it is indicated upon tearing, throbbing pains and pain that worsens with movement. So when you keep moving, it will be paining. So that's people, arnica will help. Knees are stiff and painful. Bryonia will help. Bryonia will help. The hot swelling of feet. Feet will be swollen and we feel like that. Red joints, swollen, hot with stitches and tearing pain. Worse on these movements. Every spot is painful on pressure. Constant motion on left arm and right leg, left arm and the leg. Bryonia has shown to have anti-inflammatory and analgesic properties. So Bryonia, now we have seen the symptoms: stiffness on the major joints and red, hot, swollen, and worse in movements. Anti-inflammatory action of bryonia will help the patient. Chlorofillum is recommended to treat migrating pain in small joints of the hands and feet. So hands and feet which are called small joints, typically it is prescribed to women. Indications are severe drawing, rheumatic pain and stiffness in the small joints, fingers, toes and ankles, etc. Aching in the wrist. Cutting pain on closing hands. When you close hands, it will be cutting pain. Erratic pain, changing place every few minutes. Like it will be on the tip of the finger, it will move to other place like that. Right? It will keep on moving. Chlorofillum has anti-inflammatory activity and anti-rheumatic properties also. So chlorofillum is a very good medicine and is mostly given for women patients. Causticum is used for rheumatic and arthritis accompanied by joint deformities and weaknesses. It may help relieve joint pain, stiffness and swelling, but cannot reverse any damage, joint damage or deformity. It is indicated on the left side for left side sciatica with numbness, paralysis of single part, dullness, head, tearing pain in the hands and arms, heaviness and weakness will be there. Tearing joints, unsteadiness of the muscles of the forearm and hand, numbness, loss of sensation in the hands, contracted tendons, weak ankles, better by warmth, especially heat of the bed. Burning in the joints, unsteady walking, easily falling down, and restless leg at night, cracking and tension in the knees, stiffness in the hollow of the knees. So there will be stiffness there in the back of the knee side and itching on the dorsum of the feet. So it will be common for most of the elderly people. These sort of symptoms are common, and causticum is the medicine which has to be remembered. Next is colchicum. Colchicum is used to relieve chronic joint pain and inflammation associated with rheumatoid arthritis, indicated for tearing pain that worsens with cold air, and pain migrates from one side to another. Sharp pain down the left arm, tearing in the limbs during warm weather, stinging during cold times, and pins and needles will feel in the wrist and hands, fingertips will be numb, pain in the front of the thigh. Then thighs, the right plantar reflexes suppressed. Then limbs will be lame, weak and tingling, pain worse in the evening and warm weather, joint stiffness and feverish, shifting rheumatism, pain worse at night, inflammation of great toe, gout in the heel, cannot bear or to have touched or moved, tingling in the fingernails, knees strike together, knees will be striking together and can hardly walk. Rheumatis, swelling and coldness of the legs and feet. So these are used for advanced rheumatic arthritis patients. They have a lot of deformities and all those symptoms what we explained now, numbness and pins and needles and knees are knocking and all these things together. So these people will be feeling better with colchicum. Next is Leventhal. Everybody knows Leventhal, and Leventhal is used for treatment of arthritis that starts in the feet and travels upwards. So always the pain from the bottom, it will go upwards. So the other parts of the joint. Opposite is the pain starts from the top and go downwards. It's called, if we are using cardia. Indicated for gout pains that shoot all through the foot and in joints, but especially in small joints. Swollen, hot, pain, throbbing in the right shoulder. Pressure in the shoulder, worse in motion. Cracking in the joints, worse by warmth in the bed. Gouty nodocytes. So joints will be feeling gouty like globules. That is swelling. The ball of the great toe will be swollen. Ankles will be swollen. Soles of the leg is painful. Can hardly step on them. Easy straining of ankles. So these are the symptoms of Leventhal, and veins are flowing, starting from below lower area and going upwards is Leventhal. The stalks. The stalks comes from poison ivy plant. and is indicated when the affected area is hot, painful and swelling of joints. So pains are tearing the tendons, ligaments and fasciae. The rheumatic pains spread over a large area of the nape of the neck, loins and extremities. Better by motion, soreness of condyles of the bones, limbs are stiff and paralyzed, worse in cold fresh air and damp weather. It makes the skin painful, pain along the ulnar nerve and tearing down the thighs. So radius and ulnar we have. So in that the ulnar is this side, the inside of the arms, and radius will be on the outside of the thumb side. This is the radius. So ulnar is painful. Then numbness and formication after overexposure. Paralysis, trembling after exertion, knee joints are tender, loss of power in the forearm and fingers, crawling sensation in the tip of the fingers, tingling of the feet. So Rustox is anyway a very good rheumatic medicine, and it will help the patient in a big way if it is given in the right time. Next is Actia spigata. Actia spigata is mainly indicated for wrist and wrist pain and swelling. The small joint rheumatism. This is another medicine which is very effective. Wrist is also red and heat. Pain is worse by motion. So it is also indicated to treat pains and swelling of other small joint of fingers, toes and ankles. This is for small joint rheumatism. Ruta graviolicis is another medicine. Ruta is indicated for bluish feeling of the spine and limbs, small of the back and loins. Legs are pain while rising from the chair. Hips and thighs are weak. Contraction of the fingers, pain and stiffness in the wrist and hands. Ganglia sciatica, worse lying on and down in the night. Pain from the back of the hips and thighs. Hamstrings feel shortened and tendons sore. Aching pains in the Achilles tendon. Then thighs are painful when stretching the limbs. Pain in the bones of the feet and ankles, great soreness. So Ruta is again a very wonderful medicine to relieve these sort of rheumatic pains, and it works very well. Ruta. Calcarea carp is an important medicine to manage pain and swelling of the knee joints. Pains are drawn and drawing, tearing in nature. Knee is swollen mostly at night, and it also is hot and tender to touch. This is Calcarea carp. Then Sanguinaria canadensis is another medicine. Sanguinaria works well to treat the shoulder joint pain. So shoulder joint pains with rheumatic pains, it helps to reduce stiffness in it, and shoulder pains get worse by raising the arm. Pain worsen at night. So shoulder joint pains, which is worsen at night and stiff when you raise your arms, sanguinaria is to be remembered. And that's all for the time being. I think I have covered a lot of medicines which we can review if required now. And I will be handing over the class to Murthy sir. Murthy sir.
Is my voice audible?
Yes, sir.
Namaste, my dear homeopaths. Thank you very much, Arnup Kumar sir and Surendra sir. Today you have taken excellent topics. Any questions in this?
Sounds of please share that PPT sir.
Sir, Suresh Rao is asking us.
We'll do that.
Okay, thank you.
Any questions? Shall I ask one question? Hello. When Arun Kumar sir is taking the session, he has given certain points in that. Out of that one, I want to ask one question. Carpal tunnel syndrome. Carpal tunnel syndrome. What are the medicines available in homeopathy? He himself has told so many medicines. From there itself you can tell. What is the carpal tunnel syndrome? What are the medicines available in homeopathy? Anybody?
Colchicum, sir, colchicum.
Okay. Then anything? Actually, what is carpal tunnel syndrome? Actually, in which area it will occur? In which area the pain comes? That pain they will named as carpal tunnel syndrome. It is wrist. Wrist, preferably thumb, first finger and second finger it will attack. Last two fingers generally it will not come. That is called carpal tunnel syndrome because their muscles are very weak and nerves also become weak. So you can put it in our language, homeopathic language, it is small joint pain. So for small joint pain, like that we have to come. What are the symptoms? He will tell the name of the disease. We don't want that one. What will be the symptoms of that one? Symptoms were only small joints. So we have to convert that total symptoms or the definition of carpal tunnel syndrome into homeopathic language. In this homeopathic language, it will come as a small joint pain. If small joint rheumatism or small joint pain is there, what are the medicines available for that?
The Ruta can be given.
Excellent. Next.
And Actacia.
Huh?
Actacia.
Actia spicata. Actia spicata. First and fundamental medicine is Actia spicata. After that, Collopilum. After that, Ruta.
Yes, sir.
The supplementary drugs will be, these are the main drugs. Supplementary drugs will be Causticum, Hypericum. Next, Ladampa like that. Rustax. Rhododendron, Rustax comes in the night. You can give. Rhododendron is a seasonal drug. When any winter or rainy season, the pains are aggravated more means rhododendron will come. If night aggravation is there means you have to give Rustax.
Sir, can we give Urtica urine?
I am coming to that. So this first category is Actia spicata, Collopilum and Ruta.
Yes, sir.
Second supplementary drugs are Causticum, Hypericum, and you can give Arnica. This is the second drug thing. Suppose if it is seasonal means rhododendron you will go. If it is night aggravation is more means Rustax you have to add. Suppose it is a gouty attack also. When gout system symptoms also there, and the person is having gouty diathesis, then you have to take what medicines?
You can give Colchicum, sir.
Colchicum, next.
Then acid benzoate, sir.
Acid, very good, excellent. Next and third one, you yourself has told, Urticarians. So these are the things you have to, any case comes means you have to bring that case in such a manner, you have to convert into our symptoms, from there convert into a homeopathic language, from there you have to arrive that one. And that what are the primary drugs? Because we in our classes following 3-tier system, 3 medicines, morning, afternoon, evening. If that is the case, what are the primary drugs? Then what is the supplementary drugs? Then if it is attacked to concomitant medicine symptoms are there just like gout or like that, he has told about rheumatoid arthritis, inflammation will be more there. Certain medicines will require D3, at that time you have to go in that manner. If inflammation and oedematous is there, epismal will come and apocynon will come.
Sir, there is one liquid medicine R73.
Yes, that we can give as a supplementary. And fundamentally, after treating 10 days or 15 days, whatever it will be, 3 weeks, you have to give a toning up of medicines which will call biosalts. In that biosalt, bio number 19, along with calcarea 4 you have to give. Calcarea 4 separately we have to give, and bio number 19 also we have to give, minimum 1 month to 1.5 months. Then only the original energy of that part will be restored. Suppose a 60 years, 65 years man or a woman has come to you. So at that age, what about the strength of that part will be restored by this toning up of by the biosalts. This we have to remember, we have to give like that. And some more things also he has taken. Several weeks back, I think 3 to 4 weeks back, I have told that Surendra sir, when he started that Tridosha, please convert all Tridoshas into our symptomatic homeopathy. Anybody tried that one? What Tridosha? Vata, Pitta, Kapha. Vata means Shreshma. Shreshma means the respiratory oriented drugs. Pitta means liver and gallbladder liver oriented drugs and stomach oriented. Vata means rheumatism. These are the things. In this you have to arrive. What are the medicines available for Vata? So a person will come, he will tell he is coming from an Ayurvedic or a Siddha. He will come, sir, my doctor is treating last 2 years with Vata. I am having Vata. Vata means what? We have to bring it out. Vata means nothing but 70% of the symptoms tally with the rheumatism, rheumatoid arthritis or rheumatic diathesis or gouty, all those things. We have to ask the symptoms. Night aggravations, day aggravations. If pains are coming, how it will come? What are the part, in which part the pains are more? Preferably ladies with whatever antimonium codum and pulsatilla work for ladies generally. These two medicines you keep commonly to give a longer duration. Immediately to respond that one, we are having R numbers are there in red well, that you can give. So many Allen company, all companies they are putting numbers, it is a confusing numbers actually. One company will go 16, one company will go 19, like that, so many things are there. But ours is after completing our course, you have to give certain toning up of medicines, either tonics or biosalts. That we have to remember. That what he has told again, in Vata means rheumatism you have to take. In Pitta when he comes means liver oriented or stomach oriented. For that we are having so many medicines. In that way, what symptoms he is telling, like accordingly we have to prepare that one. And Shleshma you know pretty well, respiratory problems. And what are there? Antimonium arsenicum, antimonium tartaricum, rheumex, elandrium and phosphorus. So many Drosera, so many medicines, Delcamara, so many medicines are there. Even when rheumatism we are told at that time rhododendron we are taking for winter and rainy season, there Delcamara also you can take it. Delcamara and rhododendron are good medicines for those seasons. 8 hours in this again. In today's class you can ask, previous class also you have to ask. Or anything you know, or tell me, anything you know other than our course you can tell, we will also share that one.
This chlorophylum, when it is given in the case of arthritis?
Small joints only. When you are having the weakness in the small joints, having pain, they cannot fold. It is only pains will come not regularly. It will come now, after some time it will come like that, zigzag type of pains will be there, chlorophylum. Chlorophylum not only for small joints, for the ladies dysmenorrhea also it will work. But good medicine, you can remember it. Along with Actia spicata and Rota, chlorophylum will work excellently. When I am taking dysmenorrhea, I have told this one chlorophylum, CBC piga, chlorophylum, magnesia pass, all those things will come along with pulsatilla and sepia. For that only we are all our faculty members, we are repeating this one and we are asking our guest lecturers also repeat the previous one because we will remember those things. Chlorophylum is one of the best remedy. And one more thing.
Can we generalize it as if women complain about the small joint pains, can we give chlorophylum as one of the remedy?
Yes, the first priority I have given Actia spicata, chlorophylum and Rota only. Na?
Small joint is for small joint pains means we have to think about this access we get out, then the other part will work. But other pains in general you can keep for women.
Okay.
Any doubts, sir? Gout generally when it will come? Actually, can we treat gout completely? Any therapy? Let it be allopathy or homeopathy or siddha, whatever it will be. When it is totally in pathological report, gouty diathesis is there. Can any therapy can cure permanently? Apart from medicines, what type of additional precautions the patient has to take?
It is retention of water mainly due to kidney disorders.
Yes. No. Gout is no water contents.
Uric acid like crystals forming in the joint.
Crystal formings will be there. There will not be any water.
Yeah, and uric acid is formed by having more proteins, and proteins are not digested properly, absorbed properly by the body. Then you have the gout diabetes. So when you reduce your protein intake, then uric acid formation can come down. By medication, you can, by homeopathic medication or other medication, you can manage the gout.
Manage the gout. Full cure is not there, but full cure also with additional precautions we can reduce further. Suppose up to 60 to 70% if you cure, another 20% we can cure by additional this thing. Once diet, second one proper exercise and walking. What is the diet regimen? They have completely stopped the mutton. Completely.
Meat and pulses.
Meat totally.
All the pulses what?
All the pulses. Palak they should not take.
Yeah.
And pastry food they should not take. Leafy vegetables they can take. General vegetables, whatever it means, fruits they can take.
But should we reduce pulses?
Pulses mean
You have to manage gout means you have to reduce pulses. The proteins of the pulses, especially this groundnuts and all. Groundnuts and all.
Chana.
Yeah. Yeah, all those things will, if you can see that the pains come down when you don't take these sort of pulses.
Okay.
It is basically proteins that will be producing, like when you digest the thing, protein, then there will be urea formed when uric acid crystals are formed in the system, and those get deposited in the joints.
Yes.
So when you reduce the proteins, then the uric acid excretion will be less.
Can be less.
Yeah, you can drink water and excrete off all the things, then that means your system will be clean also, and chances of getting this gout also will be less. So drink proper water, even if you take proteins and medicines, you take water and then let the urine be constantly kept removed from the body, urea. So uric acid will not be there in the blood.
Okay, sir.
the pulses means the rasma and Bengal gram, full Bengal grams are there, na? That we should not take. Like this pulses we have to avoid. And one more thing, barley water you have to take more. The banana tree inside white stem will be there, na, still. That we can take. That banana fruit, not fruit actually, flower. Banana flower and banana stem, that we can take, and barley water we can take, and Berberis vulgaris in mother tincture we have to take.
This one, benzoic acid.
Benzoic must it is must. You have to give benzoic acid daily 1 dose. Any doubts? Gout is very difficult, sir. You have to ask any painkiller is there. If any pain comes, means immediately you have to attend painkillers.
What reduce creatinine, sir? Creatinine.
What medicine?
Creatinine is a waste product by the
Yes, sir. How to reduce it, sir?
and it is normally managed by the kidneys properly. When the kidney is not functioning properly, then the additional reactivity remaining in the blood. So you have to take care of the kidney things. Apis meth is one of the good medicines. Is one of the good medicines.
Best medicine. Any doubts? Otherwise, close the class. Anything you will tell to us? You have come across any through magazines or through general discussions?
What is that? What's the difference between Actia spicata and Actia racemosa?
Actia racemosa will work on the upper respiratory.
No, both are same medicine.
No, Actia racemosa है.
No, both are different. Okay, yeah. Yeah.
Any doubts?
Well, nowadays in Kerala, these children are getting tomato fever, they call. I don't know why it is called tomato fever. Redness in the body.
Redness.
Small children, they are getting this problem. Locally, people say tomato fever. In homeopathy, if you relate, how we can treat it, sir?
It's a viral disease, and belladonna is one of the important medicines. Belladonna because of the redness. Anti-inflammatory medicines, whatever we discussed now, will work. All these rutas and all those medicines which will show even arnica can work, but the arsam will work. And the
Bacteria will work.
Main bacteria.
Okay.
Redness, belladonna. Remember redness.
Okay, thank you.
Apis med also can work because of that swelling.
One of our senior MPHA student, they are residing in Kerala. Some I forgotten that Kannur or something is there. She will always when treating any doubts comes me, she will tell. Last week she has telephoned and asked about this what Judge sir has told about that one. For her I told arsenic, epismal morning, afternoon arsenicum album, and evening arsenicum album, and evening I have given some other medicine, I forgotten. So she told yesterday it's somewhat cured. Because nobody knows what it is coming. So first primarily we have to give this one. Belladonna is the most important because redness and this, but it is itching. I think third one is mesothelium I have given. Arsenicum album, epismal arsenicum album, mesothelium. Whenever any burning sensation or redness is there, you give belladonna 1 or 2 doses. But yesterday, after 1 week or 10 days, yesterday she wrote, they have somewhat improved. But nobody knows the symptoms and everything. Only by visible, it seems to be Surendra garu Dadduru levantaru thrash, like something thrashed red color. Thrush or thrash.
It is rashes,
rashes. Spot wise will come.
It is viral type of fever.
So nowadays so many things are we are importing, sir. So many things are coming from nearby.
Yes, sir.
Yes.
8-10 years back I was there in Kerala, and then I had this tomato fever. Both the ears and all will be swollen and red. Like all the areas will become red, and it was swollen. Then all these medicines what we discussed only work. Belladonna, arsam, and all those things work.
Okay.
Both the ears were like as somebody has boxed my ears, like red hot and swollen and painful also. All these things, and even this area one became red. It was viral fever, and joint pains also was there. So I thought it was chikungunya combined with this other virus. So, but actually it was a viral infection.
Okay, sir. Thank you.
Okay, sir. So shall we close today?
Okay, sir. Thank you.
Thank you, sir. Thank you very much. Next class we will meet.
Thank you.
Okay,
Thank you.
Thank you.
Thank you.
Thank you, sir.